Patience. It's about 10:03 right now, and we'll go ahead and get started. We've got quite a few people who have registered for today's webinar, but let's go ahead and continue without delay and have folks join us as we are in progress. Again, it's my pleasure to welcome you. My name is Christine Callagher. I'm the Assistant Director here at the Gwynn Center, and I'm excited to have you with us today for our First Look webinar, where we're going to be discussing the latest report in our federal funds series. And this is particularly an analysis of pass-through dollars to Nevada's nonprofits, something that is not only timely, but incredibly relevant and, dare I say, urgent. Before we get started, just a couple of housekeeping items for us. I'd like us to remain muted if we can, to ensure the best audio quality, not just for today, but also for the recording that will be available afterward. And also, throughout today's presentation, please feel free to submit your questions using the Q&A feature. You can use chat as well, but the Q&A feature is even better because you have the opportunity to upvote other attendees' questions along the way, which is a nice thing to affirm other people's questions that you might want to have asked. Please don't feel the need to wait until the end of the webinar to submit your questions. Do so anytime as they arise. We'll go ahead and collect them as we go and answer as many as we can as time allows during our Q&A session. So for those joining us for the first time, the Gwynn Center is Nevada's statewide independent, nonpartisan policy research center. Our mission is to provide objective, evidence-based research that helps policymakers, community leaders, and the public better understand and, more importantly, find solutions to the issues that are facing our state. We work across a variety of policy areas like education, health and social policy, governance, natural resources, economic and fiscal policy, and of course, the varied intersections of all of those spaces. And in some cases, we track long-term policy impacts and trends, in some ways for more than a decade, as with our ongoing analysis of Nevada's biennial budget. And in other cases, we respond to urgent and relevant policy questions of the moment. And this report is distinctive in that it's a great example of both. Nevada's federal funds performance has historically ranked below other states, which is an issue that we started studying more than 5 years ago. Our 2021 report on federal funds offered options to help Nevada recoup more federal dollars, including recommendations that were adopted and implemented by the state. And in 2025, the federal funds landscape shifted significantly, which of course raised questions not only about Nevada's share of federal funds, but also about its reliance on those dollars. And today's report continues our work examining Nevada's relationship with federal funding. And I'm thrilled to dive into this conversation with our report's authors, Pierron, our Director of Health and Social Policy, and Mark Krmpotic, our Senior Fiscal Analyst. They have co-written our past two reports on federal funds in Nevada. And I quite frankly, I know I'm biased, but I couldn't imagine better guides for us on this complex policy issue. So thank you, Pierron and Mark, for stepping in and lending your expertise to us for the next hour. We truly appreciate you so much. So without further ado, I'd love to just go ahead and jump in with both feet. So Pierron, the first question is for you. What prompted the Gwynn Center to take a closer look at federal pass-through funding to Nevada's nonprofits?
Yes, thank you for that introduction, Christine. So we have published two reports in the past year. We published a report in early 2025 that was published in April, and then just about a year later, we published our most recent report, looking at two different aspects of federal funding here in Nevada. And largely the impetus of both of these projects was the changing landscape and continues to be the changing landscape at the federal level when it comes to federal funding. In early 2025, we saw a lot of fast-paced conversations regarding freezes to federal funds, clawbacks, certain federal funding sources going away entirely. And it was really difficult to track those conversations and then tie it to the programs here in Nevada and understanding what services it would affect. And so with that context, the Gwynn Center was really interested in diving into what programs are connected to these federal funds and what's the overall federal funding picture here in Nevada. And so, to give a little bit of background and to dive a little bit deeper into some of your introductory comments, Nevada has historically ranked low when it comes to the federal grant funding that we're capturing. And first, I want to emphasize it's not that we haven't made significant progress. In fact, from federal fiscal year 2008 to 2020, Nevada increased the federal grants that it was capturing by over 300%. So we are chipping away and we are making progress. And we're seeing that bit by bit in where we rank. In federal fiscal year 2014, we ranked 50th. We were at the very bottom. We climbed a bit by 2020 and moved our way up to 45th and then slipped back down in 2023 to 47th. But that's not to say that we haven't been making improvements. We just haven't been making those improvements in a vacuum. Other states have similarly been making those improvements in those federal grant funds that they're capturing. And also, I would just note over that period of time, the legislature and the governor created the Office of Federal Assistance in the governor's office, which is designed to be this single point of contact for Nevada's federal funding. And they have done tremendous work in streamlining our efficiency so that we can better capture and use those federal grant funding. So with that historical context of where Nevada has existed in the federal grant funding space, combined with that changing landscape in federal policy, and then layering that all on top of the fact that Nevada has traditionally had a lean state budget and has relied heavily on nonprofits to provide direct services, which in turn rely on government funding. The Gwen Center was really interested in pulling that all together and seeing what information we can find to give more clarity to what Nevada's picture is specifically when it comes to federal funding.
Excellent. And Mark, I'm hoping you'll be able to jump in quickly before we go any further to just clarify for audience members who may not use this terminology every day. But what do we mean when we're talking about federal funding or federal pass-through dollars?
So, federal funding is associated with funding that comes from the federal government, and the pass-through terminology simply means that the money that is received from the federal government comes into a state budget, state government budget at the state level, and is passed through to either local governments, school districts, nonprofits, as Pierron mentioned, or other entities that we noted in the report. And that could be accomplished through subgrants or through some kind of a formula distribution, as would be the case with Title I funding in K-12 education.
Excellent. Thank you so much for that clarity. We want to be mindful that not everyone exists in that space every day. So thank you for that important context. And so digging in, Pierron, can you go ahead and tell us how federal funding gets distributed to the state of Nevada?
Yes. So the specific question that we looked at in our first publication that we released last year is what is the federal funding picture here in Nevada when we're looking at the state budget specifically. So we looked at the 23-25 biennial budget, looking at Nevada's top 5 federally funded state agencies. So generally speaking, when we're talking about federal funds coming into the state budget, we can see that federal funds make up approximately a third of our statewide revenue. For the 23-25 biennium, it was 27.7%. For the current biennium, it's up just a tick to 28.1%. So generally speaking, we are reliant on federal funds for about a third of our statewide revenue. And when we talk about where that's going, so which agencies that's getting distributed to, the top 5 here in Nevada are Health and Human Services by a landslide. We can see that for the 23-25 biennium, those federal funds went to Health and Human Services nearly 80%, then followed by Transportation, Education, Agriculture, and DETR as the top agencies that are receiving that federal funding. And so in this brief, we dig further into what that looks like when we're tying it to specific federal funding sources. And I would say, if you haven't seen this report yet, the real heart and soul of this first report is the appendix, where we break down agency by agency, program by program within each agency of what that program is, what the state budget, what the overall budget for that program is, what portion is federal funds, and then most critically, what is the federal funding source? And that goes back to trying to navigate those conversations of certain funding sources at the federal level are changing and being able to connect it specifically to the programs here in Nevada. And so that was the critical aspect of our first brief, is how can we connect those federal funding sources to the programs here so that individuals, policymakers alike can navigate what those changes might look like here in Nevada. And then, sorry, Christine, you're muted. But I'm going to jump in. Actually, before you go to the next question, I just want to talk about how that funneled into our next piece of the study. So following that brief, it did answer a lot of questions. I think we hope it was a useful tool in navigating some of those conversations. But as with many of our briefs, while it did answer questions, it provoked a lot of questions as well. And one of those questions that really rose to the top is, where do they go next? So we recognize that those federal dollars are landing in those state agencies, but they don't land there and stop. Many of those dollars pass on out of the state agency to our communities, whether that's localities, school districts, nonprofits, what have you. And so we took this on as a part 2, and that's what our current most recent report is looking at, is where do those federal funds go once they leave the state agency, and how much goes to nonprofits. And so in that study, we focused on the 3 top agencies that engage in federal grant distribution for state fiscal year 2025, which was Department of Health and Human Services, Department of Education, and Department of Agriculture.
Excellent. Thank you, Pierron, for centering us on that primary research question. And so the next natural place to go is the how. So Mark, I'm going to bring you back in. Can you please share with us a little bit about how this study was designed and which data we used for this analysis?
So yes, thank you. In working with the Office of Federal Assistance and state government, myself and Pierron were able to receive some information from the state accounting system, which we reference in the report as DAWN. It's an acronym, DAWN. That's the State Financial Data Warehouse. And knowing the budget structure, having worked in state government for so many years, looked through the state budget and gathered those specific areas, primarily the ones we talked about, Department of Health and Human Services, DETR, and the Department of Agriculture, to find those categorical expenditures that pass through federal funds to the state agencies, nonprofits, and so forth. So we literally received downloads of those, or snapshots of those expenditures from State Fiscal Year 2025, and went through the process of consolidating that information, organizing and sorting through it to get to the information that you see in this report. And I would just, again, note for our listeners that our earlier report in April 2025 looked at the state budget as far as what the legislature approved for state fiscal year 2025. This report examines actual expenditures that were passed through to the various entities, federal funds that were passed through to the various entities in state fiscal year 2025.
Thank you so much, Mark. And I think it's important to underscore, the data collection in this process was meticulous and quite time consuming. And And so both Mark and Pierron deserve an incredible round of applause for their commitment to digging into these data and coming up with some findings. And so this is a good point, obviously, to get into those findings. And so, Pierron, please share with us some key takeaways, observations, a little bit of commentary about that central question, how those dollars are reaching our state's nonprofits. And I think also we have to acknowledge that as much as we did find, there of course were things that there were questions we were not able to answer. And so please dig into all of that for us.
Yes, great setup. Because I would really say that the largest finding, which was somewhat of a surprise to me, maybe not to others, but was really what we didn't find, and that the data infrastructure here in Nevada is such that we're not able to fully map that. And we had set out with this goal to map those federal funds and understand better how they move out of state governments into our communities, which nonprofits they're impacting the most, how those dollars are being spent, better understanding how it affects our direct services in Nevada. And unfortunately, the data is such that we weren't quite able to get there with this study. But what we were able to look at is a snapshot of data. And we were able to look at a snapshot of $818 million that passed through in fiscal year 2025 through Department of Health and Human Services, Department of Education, and Department of Agriculture. And recognizing that this is a sample snapshot, but it does create some picture of where these dollars are going. And also recognizing that what we were able to see is where it goes as a first stop. And so we know that these dollars may get further passed on, further subawarded. And so it's not a complete picture as to where the money is landing, but it is a picture of where the money is going when it exits the state agency. And so the information that I have on this slide, the graphic here, is displaying the first recipient entity as it leaves the state for that 818 million that we looked at. And we can see that over half, 57%, went to local school districts and charter schools. So pretty significant. And I think also a really good example of we don't have the full picture. And we do know that those local school districts and charter schools engage with community-based organizations, engage with third parties to provide a lot of services. So there's still a lot of information that we're interested in finding out. And then because we just looked at this snapshot, our brief also provides a lot of context and narrative as to the federal funding landscape here in Nevada. And part of that is providing an understanding of the pathways that a nonprofit may receive federal funding, recognizing that the scope of our project and the fairly narrow scope of our project was looking at this first pathway of state pass-through funds. Those are coming into our state agencies, and then they're getting subcontracted out to nonprofits or localities or whatever it is, and then maybe trickling down to nonprofits. But there's a number of other ways that a nonprofit may receive funding. They can receive it as a subaward from a larger nonprofit. They can receive it through fee-for-service reimbursement. I think this is a really good example of how our data was not apples to apples and creating a full picture. In fact, there's a lot of federal funding that comes into Nevada. In fact, a bulk of the federal funding that comes into DHHS is Medicaid funding. And it's really hard for us to calculate the impact that has on nonprofits as those federal funding mechanisms change when it comes to Medicaid. And so there's two aspects that Medicaid can affect our nonprofits here in Nevada. And one is there are nonprofit providers of Medicaid. So in Nevada, there's 377 Medicaid providers that are operating as nonprofits. A common example would be a federally qualified health center. These are health clinics that are operating as nonprofits, but they are providers of care to Medicaid recipients. And so they are receiving reimbursement through Medicaid in that manner, directly impacted by how Medicaid is administered here in Nevada. And then the other side of how Medicaid affects nonprofits is there is a required reinvestment into our communities. So our managed care organizations here in Nevada that are in the insurance providers under Medicaid are required to reinvest at least 3% of their pre-tax profits back into the community. And those reinvestments go to nonprofits here in Nevada. And because Nevada is a state that really values transparency, all of that information is public. We do discuss this reinvestment overview in our report, but we also do link to the publicly available report from the Medicaid Reinvestment Advisory Committee, which details each of the MCOs here in Nevada and how they've reinvested their money here in Nevada. So just recognizing that there's multiple pathways, but shifting back to the snapshot that we looked at, our report does go through each agency and what that breakdown looks like for each of the 3 agencies that we looked at. And on this slide here is the information for Department of Health and Human Services. Of the 818 million that we looked at, 319.9 million passed through Department of Health and Human Services. And we have the breakdown here division by division to show that it does look different than that overall snapshot. We see that generally 44% is going to local government agencies and about 40% is going to nonprofits. And this is really highlighting the different types of services and different types of grant performance that we see under each of these agencies. And we do go through, again, our brief provides a greater level of detail in the appendix, which I think tells a broader story and is, if you're interested in digging in and painting that picture a little bit broader for yourself, this is a great place to do it. So we do provide a breakdown for each of the divisions, each of the agencies, going program by program, giving the federal funds that are flowing through that program, again, the federal funding type, and then the pass-through entity by category. So we don't list them by name, but you're able to understand better how much of that federal funding source is going to nonprofits versus local governmental agencies or interagency transfers, these various different categories. And then it also is good at giving you a better picture of what these services are and what these federal pass-through dollars are being used for. Just to highlight some on a high level for the funds that are passing through Department of Health and Human Services, we see a lot of childcare subsidies. We see our health clinics for WIC recipients. We see behavioral health and substance abuse treatment, a really, really wide range of services that are being provided through these pass-through funds. In Department of Education, we see preschool education through Nevada's Nevada Ready Pre-K program. We also see adult education programs that help individuals obtain their high school equivalency certification. Initiatives for our after-school programs in high poverty communities. So again, a wide range of services. And then in Department of Agriculture, we see a lot of those food assistance programs. Again, a lot of them in schools. So we see our summer breakfast, our summer meal programs, our school milk programs, our breakfast programs. But it's also supporting our food banks, the Head Start programming for preschools and early learning centers. So really, really wide reach of where these pass-through dollars are going here in Nevada.
All right, Pierron, thank you for that excellent overview and also for pointing out the fact that as much as we set out to explore that central question, they're quite frankly, because of the data infrastructure in the state of Nevada, we weren't fully able to answer that question. So if we do embark, let's say, on a part 3 or part 4 of this study in an effort to trace the entire life cycle of a federal dollar from receipt to end use, what are some areas that you would want to explore for that future research? And I think I would love, this wasn't planned, but I would love to have Mark respond to that question as well.
Yeah, so I'll start it off and then I'll pass it off to you, Mark. So we have a lot of ideas on how we want to drill down, and I think we're pretty motivated and continuing to work on this here at the Gwen Center. But to drill down on that question of what is the tie of these federal dollars to nonprofits here in Nevada, we would really like to do a closer examination from a qualitative perspective on the impacts that we're seeing on our nonprofits. So we'd love to do a sample study again, looking at small, medium, large nonprofits and understanding better what's the portion of your budget that is reliant on federal funds. If that changes, or have you seen changes, how does that affect your staffing, your services, your ability to keep your doors open, to closer tie that connection of the impact on services to Nevadans when it comes to federal funding. And then similarly, just outside of the current context, to also understand what are difficulties. We recognize that here in Nevada, we are really predominantly reliant on nonprofits and third-party organizations to provide a lot of direct services. And so what are obstacles in doing so through that system? And are there areas where we can improve that efficiency so that not only our direct services are expanded here in Nevada, but potentially we can capture more grant funding that way? And then from a little bit of a different angle, just to paint the picture a little bit broader, we would love to drill down. So we recognize that in this study, we were only able to see where it goes when it leaves the state. We'd like to follow those funds a little bit further, do similar studies at the locality level, at the county level, with school districts and charter schools to understand just how that money is moving through the state.
I would add to that by pretty much echoing what Pierron indicated. I believe we noted in the report also that some federal monies may not flow through the state budget, but may flow directly to nonprofits or other entities, or certainly directly to local governments, and then possibly pass through to nonprofits as well. So that is information that would not have been captured in this report. And then truly understanding I think, the money that flows to the nonprofits, but also the services that they provide to citizens of the state that are along the lines of some of the services provided by state government, where state government utilizes nonprofits or local governments as well, trying to really understand the full landscape of who and what dollars are providing those services.
Yeah, and if I can just jump back in, what we have seen is there are some national level studies that are trying to look at this, and we do talk about it in our publication. There's a study that was done that is looking at by percentage where are these federal funds going as far as category, health and human services, education, nutrition, breaking it down by category, and then also some survey data on what changes were seen in that first 6 months of 2025 as there was uncertainty and freezing of funds and just a lot of systematic changes in federal funds reaching these organizations, how it affected their budgets, their staffing, their services. And so, again, a really helpful piece of the picture, but what we would really love to do is to have Nevada specific data on that, understanding what the picture is here, and as much as possible, just expanding on what we know as far as the federal funding landscape here in Nevada.
Mm. Thank you both so much. And I know we would be remiss without addressing some of the policy considerations that emerged from this study. Though we were not able to fully address that primary question, our policy considerations may actually go take us leaps and bounds in the pursuit of the answer to that question. So go ahead and share with us what some of those recommendations are.
So shouldn't be too much of a surprise based on really a lot of the comments that I've already made, but investment in a data infrastructure that will allow us to track for this better. And, I've spoken a lot about our interest in just painting as much of a picture as we can. And, we've got this little corner pictured and we want to fill out that full picture. And that's really important. But without building also a data infrastructure that can keep up with this information, it puts us in a place where we'll have to do these studies every 5 years, every 10 years, maybe more frequently to just understand the picture. And if investment is made and just processes are changed so that this data can more easily be tracked and easily accessed, it'll make it that much easier for our policymakers to find that data, digest that data, and make decisions based on that data. And then the other piece of this, which I haven't really touched on yet, is an audit of the service continuity risks. So what I have mentioned is we're a state that is highly reliant on non-state government entities providing services. And something that is really critical tied to this question of changes in federal funding is which of those services is the state required to provide? So statutorily, constitutionally required services. There are certain services that the state is required to provide its citizens. And for many of those, we rely on community-based organizations to provide those services. And I think a really good example is children's behavioral health. We know that the state went through a DOJ investigation and has entered a DOJ settlement on providing more community-based services for children's behavioral health, and puts us in a position where we are then really reliant on community-based organizations to provide these services, which does make sense in a lot of aspects. They have more flexibility, they have more expertise, they are in the communities, they are often better able to provide those services. But to the extent that they are reliant on government funding to keep their operations going, it puts us in a position where we don't really have a full picture of what happens if those funds are not sufficient to keep those services going. And what does it look like if the state is then required to provide those services itself from both a financial perspective, but also do they have the expertise and the ability to provide those services? So that's a lot of aspects to look at, but some sort of audit of what services Nevada is really dependent on community-based organizations to provide and how that might be affected if there's a change.
Thank you, Pierron, and I definitely want to pull on that thread a little bit more as we head into the Q&A section of the webinar and talk a little. We've talked a lot about, I guess you could say, what's coming out of the faucet, but we haven't talked a lot about the tap and what continual federal changes might mean for what is arriving in the state of Nevada and how that's affecting client services and end use services for Nevadans. So we'll get to that in a moment. But first, we're closing in on the end of the moderated portion of our webinar. Just a couple more questions for Pierron and Mark from me, but really I want to turn it over to you. And so I can see there are still a good number of people on the call. Now would be a great time for you to enter your questions into either Q&A, which is preferred, or the chat function. Please go ahead and do that now so that we can make sure that your questions are answered before we close up shop for the day. But before we do that, I'd like to ask a couple of reflective questions of both of you. Kind of some of the takeaways that may not be immediately evident in reading the report itself. And I would like to note quickly that you have a QR code on the screen that you can scan to view the report. And also, I just dropped a link to the report in the chat if that's an easier way for you to navigate to it. So I'll go ahead and start with some reflections from Mark. So Mark, can you tell us or can you share something that you learned in the process of doing this research that may not be obvious from reading the final report?
So from my perspective, I worked in the state government for many, many years and at the legislature for 20 years. And a tremendous amount of my focus was on how the state general fund was spent and where those monies went and so forth. And never focused on federal funding and how that was spent and where it flowed to. I mean, I had a general idea, but I never really unpeeled it and delved into it granularly like I did in this report. So just really, Christine, just understanding, um, where the money goes and how it's spent and those entities that receive it on a pass-through basis. And then when the readers, we've pulled some of the information into this report, but when the readers review the April 2025 report that we published, and then the legislatively approved budget report that the Gwen Center published last year, and also this report, and understanding the size, the amount of the budget that is contributed by the federal government, in other words, federal funds, and where that money goes, and just the sheer size of it, I think really opens one's eyes to um, how much it really does mean. And I say that as somebody who really spent a lot of time focusing on the general fund and trying to balance it at the state level for so many years.
Thank you, Mark, for those insights. And I would encourage those of you who may have questions about the state budget to put them in the Q&A now, because you have one of our foremost experts in Mark to address any of those questions. When it comes to trends of federal share over time, trends, changes in the state's biennial budget over time. All of those questions are fair game, and you've got the perfect person to address them. So turning to you, Pierron, I'd love for you to share just if you can zero in on one, one main idea that you hope attendees of today's webinar and readers of the report will take away after today.
Yes, so I'm going to piggyback a little bit off of some of what Mark said, and I want it to be positive, but I am going to start by being not so positive first, but I promise I'll loop back. We dove into this. I mean, we've been working on combined these two reports largely for the last year or more. And, Mark has incredible expertise when it comes to our state budget. And I just want to emphasize the real difficulty in chipping away at this information that we were able to provide. And I really recognize that both of these reports are just providing one glimpse into aspects of federal funding here. But it was a really difficult lift. And over the period of time when we were doing these two reports, we had a lot of conversations with state agency people, with community-based organizations, with a lot of different entities here in Nevada that are equally invested in understanding this picture and the work that Mark and I did in these two projects. And so many of those conversations are, yeah, we're really interested in this too. We're also going to try to work on this. And over that year, we realized how difficult it is. And part of that is because it is comparing apples to oranges when we look at this federal funding. It is going down these rabbit holes and tracking those dollars and seeing where they go out. And so it is difficult, but I think the positive spin that I would put on it is that we just have to keep chipping away at it. There are so many people that are interested in helping with this lift, are interested in the outcomes of this lift. And with these two reports, we've been able to just expand a little bit further and a little bit further of what that picture of federal funding is here in Nevada. And we just need to keep doing that until we have a much broader picture and hopefully are in a place where that understanding and those systems can move forward and we can have that broader picture moving forward.
Pierron, thank you. I think that you've really beautifully articulated the path forward and what we can all do to row together toward that clarity. And you've kind of answered this next reflection question, our last question for you in terms of the formal part of the presentation. But what conversation do you hope this study sparks among policymakers, state agencies, funders, and nonprofit partners?
Yes, so really two pieces of it. So everything I said about let's continue this work, let's find those partnerships. We at the Gwen Center are with open arms. We love partnerships. We love this data piece of figuring out what we can find from the data. Simultaneously, the conversations that I hope happen are how do we improve our systems overall so that in 5 years, in 10 years, we aren't doing all of this heavy lifting again, but we're simultaneously creating better systems so that this data is more readily available, so that it's not always apples to oranges, that we do have some metrics that we can fully understand the flow of federal dollars here in Nevada, because without building that side by side, we'll just continually be in this position where we see our ranking changing or not changing and not really understanding the cause and effect of why or how we navigate those decisions when changes happen, which we know they do.
Thank you. Thank you so much, Pierron. I know that we spend a lot of time thinking through, how we can go upstream. We're trying to mitigate a lot of downstream impacts. And so much of this work and so much of the recommendations that emerged from this report point themselves upstream and things that we can do as Nevadans to become more resilient, but also more aware of our reliance on federal dollars, the interplay of federal dollars in the state budget, how that affects our localities and our community partners. And so I think we could all engage in that conversation meaningfully about having a more systematic approach toward understanding and collecting data that would significantly inform our understanding of federal dollars from receipt to end use. So this is a great time for you to pop in your questions. I'm looking in the Q&A. I'm not seeing any questions at the moment. I see a question in chat. You can absolutely put your questions in chat as well. And I would also invite you, since we're in the moment, if you're comfortable to unmute your microphone, please feel free to ask any questions of Pierron and Mark organically right now. All right, I'm seeing a raised hand. Please go ahead and unmute if you would like.
Thank you. Hi, everybody. My name is Tysican. I am a lived experience specialist at the Nevada Homeless Alliance. I think that this report is amazing, and I think that it will serve as a really clear guide for policymakers as they're trying to figure out how to redistribute funding with everything that's happening related to HUD's NOFO or their Notice of Funding Opportunity. Our continuum of cares or COCs have been scrambling to mitigate funding disruptions. And so I'm wondering if there's any interest in examining federal funding that passes through Nevada's housing and homeless nonprofits.
I'll jump in. Thank you, Tyson. Great question. Great to see you. I do think we're definitely interested. And actually, that ties in well to the many metrics and indicators that we're interested in looking at when we look at a qualitative study. And I hope our steering committee on this project doesn't mind me saying, but we had a really fruitful conversation yesterday about, yes, it's important to understand the relationship between changes at the federal level and federal funding to the state agencies, but it's just as important to understand the systems that go through when you're even just talking about the distribution of funds leaving the state agency to those organizations. What are those processes like? Are there barriers in place by adding more requirements? In addition to the federal requirements, the state adding more requirements, what type of burden does that place on these organizations? Do agencies use different systems to distribute these funds? And what type of burden does that put on organizations to then have to understand, oh, when funds are coming through this agency, we use this system and we need to train on that. If they're coming through this agency, we have to train on this system and look at that. And so the breadth of questions that we're really interested in looking at on that qualitative study is really wide. And I think really focused on the systems approach of what are we asking our nonprofits to really do when we're talking about the distribution of federal funds from the state government to these organizations. And when it comes to disruptions, how are they able to handle those, and what systems could improve some of those disruptions and mitigate, hopefully, closures or disruptions in services?
All right. Thank you so much, Tysican, for your question. I'm seeing a question coming through the Q&A, and it's regarding terms and conditions being placed on federal grants. And if Teresa Benitez Thompson, if you would like to unmute and provide any context to your question,
Yeah,
please feel free.
thank you so much. It just seemed to be that with this new cycle of, or within probably the last year and a half of grants coming out, that we saw a lot of organizations and nonprofits were seeing new terms and conditions on the acceptance of the grant that might run contrary to their mission or make it more complicated to accomplish their mission in terms of populations that they might be able to serve or specifically name as serving. And so I just didn't know, like, beyond the dollars flowing down in the pass through, because this information is so amazing and so good, is that, on that contractual side, if we're seeing organizations being encumbered in ways that might make it so that they either have to really shift mission, or that they have to, in fact, just flat out refuse dollars that they traditionally were used to and kind of counting on receiving.
I love that question. I think there's kind of two aspects to look at. So one, if those terms and conditions are coming from the federal level, which I think is what you're referring to, it ties back to this discussion I was having about our nonprofits and our community-based organizations having the ability to provide services that they're required to provide. And I think it's really interesting. It's going to be an interesting landscape. So first, let me answer your question in that we haven't looked at that aspect. I think that's a wonderful aspect to look at. I think it's also really interesting from like a legal theory perspective of what type of action might the state take, or might our organizations take, if they're being put in a position where they legally can't provide services that they're required to provide. And what does that landscape look like? And I think we probably will see some states pursuing legal action over those terms and conditions. We will probably see, when it comes to these DOJ settlement agreements, we could see negotiations on some of those terms of, hey, we did agree when we signed the settlement agreement that we could provide these services, but such restrictive terms have now been put on the federal funding that it's legally impossible for us to provide these services. And so from like a legal theory perspective, I think it's really interesting. It's a really interesting thing to keep our eyes on. And I think an interesting thing for our policymakers to be thinking on as well, of what options do we have when it comes to pushing back on these terms and conditions. And then the other piece, and this isn't quite what you were asking, but I think is relevant to bring up, is we similarly want to be thinking about, to the extent we're passing federal funds down, there are terms and conditions that the federal level places on those conditions. There are also conditions that the state will place on those dollars. And so being cognizant of the fragility of these funds, of how many burdens we're putting on our organizations to comply with these funds, recognizing that it's getting harder and harder for our nonprofits to administer these grants, and what can we be doing from a state level to hopefully ease that burden, but at the very least not increase the burden on them.
All right, thank you. I want to open it up. We have got about 10 more minutes left of our time to see if there are any further questions. Please go ahead and enter them into chat, enter them into the Q&A. But for now, while you're still ruminating on those questions and hopefully getting them in before the final buzzer, I'd love to turn back to this idea of auditing our service continuity risks, and taking a look upstream, pun intended, at the tap, and what we're looking at in terms of further changes to federal funds. I know both you, Pierron, and Mark, you have, although it's outside the scope of this conversation and this particular report, both of you have taken a look in your respective work in the past year or 18 months about impacts of HR1 and other federal legislation that is certainly another factor to consider in this equation of how federal funds are distributed to and through the state, and impact on end users. So I'm wondering, Mark or Pierron, if you would be able to provide any color or any commentary regarding HR1 and some elements of that bill that are set to be implemented later this year.
Yeah, I'll start, but then I will pass it to you, Mark. So first, I will just say that is so much of the context of what prompted this work. It's really hard to navigate changes or make any decisions in response to changes if we don't know where we currently are, which is what both of these studies tried to focus on, is where are we currently, because we haven't yet seen many of the changes that were in HR1. But it's also, many of those changes related to Medicaid, both in how it's financed, but also how individuals qualify for enrollment, and that will affect overall the federal dollars that our state gets. And so when we talk about metrics that are really hard to measure the impact of, Medicaid is certainly one, and we included somewhat of a discussion in this publication. We include even more discussion. We published an explainer on Medicaid last summer, which also goes into a lot of those changes in HR1 and how it's going to affect the state's ability to pay for Medicaid and also providers' ability to get reimbursed. And so, again, it's really hard to measure those effects, and largely I think those are things that we're going to have to measure as we see them implemented, but really critical to have some understanding of where we are now to see that impact. So that's just on Medicaid. I know I'm going to toss it to Mark because he explored some different aspects of HR1 as well.
Thank you. I would just remind our listeners with respect to the additional requirements placed on SNAP benefits. This report did not cover SNAP benefits in terms of the allotments that are distributed in the state. That is outside the state budget. However, there are some significant requirements coming forward in HR1 that may have a tremendous impact on the state. One is the potential for the state to have to provide matching funds for SNAP allotments, and that is based on the state's payment error rate. And I know the Division of Social Services is sharply focused on the payment error rate for SNAP to be able to fall under the, I believe it's the 5% threshold to avoid having to pay matching funds or to have to match SNAP allotments in the future. And then the special session of the legislature that was conducted in November appropriated funding to provide for the administrative costs of SNAP in anticipation of that requirement decreasing at the federal level. So where the federal government and the state provided equal matching funds to pay for SNAP administration 50-50. That was changed under HR1 to where the federal government now provides 25% match, the state 75% match, and that was an additional $20 million approximately appropriated in fiscal year 2027 to provide for that funding. So I would anticipate it was touched on during the interim legislative hearing that occurred in late April in the Health and Human Services Committee. But I would anticipate that the 2027 legislature will be sharply focused on how the Nevada Health Authority and the Division of Social Services is meeting these requirements and moving forward, because there is additional burden placed on the state and additional significant cost depending on the state's performance with respect to the SNAP payment error rate.
Thank you so much, Mark and Pierron, for addressing some of that complexity. Although, it's not necessarily in the scope of this report, it does inform the work, and there's interconnectedness with that work. So, thank you so much for taking us on that aside very briefly. So, we've got just a few minutes left. I would love to invite anyone with a lingering question or a comment to go ahead and unmute yourself if you're comfortable and speak now. All right. It sounds like we did a great job. I will take that silence as affirmation, and thank you all for joining us today. And before we wrap up, we'd love to give you a little bit of a preview of what's coming up next. We actually have another publication coming out next week from Pierron, and so I would love to give Pierron a moment to tell us a little bit about her work that's coming out next week.
Yes, so we have a publication on AI in healthcare coming out next week. It is part of our overall series on AI. The Gwen Center has done several briefs looking at what developments we're seeing in AI, what it's being used for, how it's being governed and regulated. And so this is narrowing in on the field of healthcare. It will touch on various studies that we're seeing on how AI is being used in various aspects of healthcare when it comes to actually the provision of care, to billing, to many different aspects of healthcare, how it can help and risks that we need to be aware of and keep our eye on. And it does a really great job of walking through different types of governance that we've seen when it comes to AI in healthcare, and what questions we should be asking when it comes to facing this head on and recognizing that it is expanding into healthcare, and what can we be doing to make sure that we're ensuring patient safety and ethics and privacy and all of that.
Thank you. Thank you so much. We are so thrilled to see that report come to life and to see it arrive in your inboxes and on your social media feeds next week, which is a friendly reminder. If you're not signed up for our newsletter, please go ahead and go to our website and sign up today. If you're not following us on LinkedIn, X, or Instagram, please do so that you have awareness of when we're publishing research and can engage with us then. But for now, we'll go ahead and sign off. Thank you so much for joining us, and we look forward to seeing you again later this summer at future webinars. Have a wonderful day, everyone.